Yeast infections. A yeast infection, or candidiasis, occurs when there's an overgrowth of Candida albicans in the vagina. This fungus naturally exists in our bodies, coexisting peacefully with other microorganisms. It's only when this balance is disrupted that Candida multiplies excessively, leading to a yeast infection. Think of it like a garden. A healthy garden thrives with a diverse array of plants, each kept in check. Similarly, our bodies function best with a balanced ecosystem of microorganisms. From hormonal fluctuations to certain lifestyle choices, understanding these triggers is crucial for both prevention and treatment. In the following sections, we'll delve deeper into the common symptoms, contributing factors, and steps to maintain a healthy vaginal environment. Yeast infections manifest with telltale signs that are usually easy to recognize. One of the most common symptoms is persistent itching localized to the vulva. Many women experience a burning sensation, particularly during urination or sexual intercourse. Another hallmark symptom is an abnormal vaginal discharge, often thick and white, resembling cottage cheese. This discharge may be accompanied by a faint yeasty odor. If you experience any of these symptoms, consult your healthcare provider for an accurate diagnosis and appropriate treatment. Self-treating can be risky, as other conditions can mimic yeast infections. While any woman can experience a yeast infection, some factors increase the likelihood. Internal factors include hormonal fluctuations, immune system health, and certain medications. Hormonal changes, particularly those associated with menstruation, pregnancy, or menopause, can create an environment conducive to Candida overgrowth. A weakened immune system, due to medical conditions or stress, can compromise the body's ability to keep Candida in check. External factors include lifestyle choices and environmental influences, such as clothing, hygiene habits, and diet. By making conscious choices about our health and lifestyle, we can significantly reduce the likelihood of experiencing yeast infections. Hormones play a pivotal role in regulating various bodily functions, including the vaginal environment. Estrogen is crucial for maintaining a healthy vaginal pH and promoting the growth of beneficial bacteria that keep Candida in check. Fluctuations in estrogen levels can disrupt this balance, creating an opportunity for Candida to flourish. This is why women often experience increased susceptibility to yeast infections during life stages marked by hormonal shifts. Menstruation, pregnancy, and menopause all bring about significant hormonal changes that can alter the vaginal environment. Understanding these hormonal fluctuations and their impact on vaginal health is crucial for women of all ages. By being aware of these shifts, we can take proactive steps to maintain a healthy vaginal environment. This includes lifestyle modifications and consulting healthcare providers when necessary. Our immune system protects us from harmful invaders, including fungi like Candida albicans. A healthy immune system keeps Candida populations in check, preventing infections. When our immune system is compromised, our body's ability to control Candida growth weakens, increasing the risk of yeast infections. Conditions like HIV, AIDS, and diabetes can suppress the immune system, making individuals more susceptible to candidiasis. Medications that suppress the immune system, such as corticosteroids and chemotherapy drugs, can also increase the likelihood of yeast infections. Maintaining a healthy immune system is crucial for preventing yeast infections. This includes adopting a healthy lifestyle, managing stress levels, and adhering to prescribed medications for any underlying medical conditions. Antibiotics are powerful medications that combat bacterial infections, but can sometimes be a double-edged sword for vaginal health. While antibiotics target harmful bacteria, they can also disrupt the delicate balance of microorganisms in the vagina. This disruption can create an environment conducive to Candida overgrowth, leading to yeast infections. The vagina is home to beneficial bacteria like lactobacilli, which maintain a healthy vaginal pH and inhibit harmful microorganisms. Antibiotics can kill off lactobacilli, allowing Candida to multiply unchecked. This disruption is more likely with broad-spectrum antibiotics, which target a wide range of bacteria. It's crucial to be aware of the potential impact of antibiotics on vaginal health and take steps to minimize the risk of yeast infections. Always consult a healthcare professional before avoiding necessary antibiotics. Internal factors contribute to a higher susceptibility to yeast infections. Hormonal changes can create an environment where Candida thrives, while a weakened immune system struggles to keep the fungus in check. Antibiotics can inadvertently tip the scales in favor of Candida overgrowth by disrupting the vaginal flora. Understanding these interconnected factors is paramount in managing and preventing yeast infections. By addressing these internal imbalances through lifestyle modifications and appropriate medical interventions, women can take charge of their vaginal health. External factors related to lifestyle choices and environmental influences also play a significant role. Our choice of clothing can significantly impact the delicate balance of our vaginal microbiome. Tight-fitting clothing, particularly those made from synthetic materials, can trap heat and moisture in the vaginal area. This creates a warm, humid environment that Candida albicans finds inviting, allowing it to multiply rapidly. Cotton is a breathable fabric that allows air to circulate, helping to keep the vaginal area dry. Opting for loose-fitting clothing made from cotton or other natural fibers can help reduce heat and moisture buildup. Changing into dry clothes promptly after swimming or exercising can help maintain a healthy vaginal environment. By making conscious clothing choices, we can create a vaginal environment that is less hospitable to Candida overgrowth. Maintaining good hygiene is crucial, but it's essential to strike a balance. Excessive cleansing or using harsh products can disrupt the delicate vaginal ecosystem, increasing the risk of yeast infections. The vagina is a self-cleaning organ, and the natural discharge it produces helps maintain a healthy pH balance. Using harsh soaps, douches, or feminine hygiene products can strip away beneficial bacteria and alter the vaginal pH. Instead, gently cleanse the vulva with warm water and mild, unscented soap. Avoid scrubbing or using washcloths, as this can irritate the delicate skin. Maintaining good hygiene also includes wiping from front to back after using the toilet to prevent the spread of bacteria. Our diet plays a crucial role in our overall health, including our vaginal health. Sugar can contribute to the overgrowth of Candida albicans, increasing the likelihood of developing yeast infections. Candida thrives on sugar, and consuming sugary foods and drinks creates an environment rich in glucose that Candida can utilize for growth. Reducing sugar intake may be beneficial for individuals prone to yeast infections or those with compromised immune systems. Opting for a balanced diet rich in fruits, vegetables, whole grains, and lean protein can help stabilize blood sugar levels. Staying hydrated by drinking plenty of water can also help maintain a healthy balance of microorganisms in the body. External factors, often intertwined with internal factors, contribute to a higher susceptibility to yeast infections. Tight clothing and certain fabrics can create an environment where Candida thrives, while excessive hygiene practices or harsh products can disrupt the vaginal flora. A diet high in sugar can also tip the scales in favor of Candida overgrowth. By making conscious choices about our clothing, hygiene habits, and diet, we can create an environment that is less hospitable to Candida overgrowth. These lifestyle modifications, combined with appropriate medical interventions, empower women to take charge of their vaginal health. In the next section, we will explore specific health conditions that can increase the likelihood of developing yeast infections. Diabetes, characterized by high blood sugar levels, can significantly impact our health, including our susceptibility to infections. High blood sugar levels create an environment that Candida albicans finds inviting. Candida thrives on glucose, and elevated glucose levels provide ample fuel for its growth. Diabetes can compromise the immune system, weakening the body's ability to fight off infections. Managing diabetes effectively through lifestyle modifications, medication, and regular monitoring of blood sugar levels is crucial for reducing the risk of yeast infections. By keeping blood sugar levels within a healthy range, we create an environment that is less conducive to Candida overgrowth. Additionally, maintaining good hygiene practices can further reduce the risk of yeast infections in individuals with diabetes. HIV attacks the immune system, increasing the risk of infections like yeast infections. As HIV progresses, the immune system weakens, making individuals more susceptible to infections. Antiretroviral therapy reduces viral load and strengthens the immune system. However, yeast infections can still occur, especially with low CD4+ cell counts. Good hygiene and prompt medical attention are crucial for managing symptoms. Section 3. Other health conditions. Exploring the connections. Diabetes and HIV/AIDS can increase yeast infection risks. Other conditions and treatments also favor Candida overgrowth. Understanding these connections is essential for holistic health management. Autoimmune disorders like lupus and rheumatoid arthritis can affect immune regulation of Candida. Medications for these conditions can suppress the immune system, increasing infection risks. Cancer treatments like chemotherapy and radiation weaken the immune system. These therapies can damage vaginal mucous membranes, aiding Candida invasion. Hormone replacement therapy can alter vaginal hormonal balance, increasing yeast infection risks. Discuss potential risks and benefits of HRT with a healthcare provider. Corticosteroids and immunosuppressants can suppress the immune system, increasing yeast infection risks. Discuss medication side effects with a healthcare provider. Section 4. A holistic approach to vaginal health. Maintaining optimal vaginal health requires a holistic approach, addressing internal and external factors like lifestyle choices, hygiene, and underlying health conditions. Open communication with healthcare providers is crucial for managing and preventing yeast infections. In the next section, we'll explore practical preventive measures and tips for avoiding yeast infections. Tips for preventing yeast infections. Maintain good hygiene, wash with mild soap, and choose breathable fabrics like cotton. Avoid harsh soaps and douches. Change out of wet clothes promptly. Probiotics, often referred to as good bacteria, play a crucial role in maintaining a healthy balance of microorganisms in the gut, and emerging research suggests that they may also offer benefits for vaginal health. Probiotics can help to restore and maintain the population of beneficial bacteria in the vagina, particularly lactobacilli, which are essential for preventing yeast infections. Lactobacilli produce lactic acid, which helps to maintain a slightly acidic vaginal pH. This acidic environment is inhospitable to Candida albicans, the fungus responsible for yeast infections, helping to keep its growth in check. Probiotics can be consumed through fermented foods, such as yogurt with live and active cultures, kefir, sauerkraut, and kimchi. These foods naturally contain beneficial bacteria that can help to replenish the vaginal flora. Probiotic supplements specifically designed for vaginal health are also available. These supplements typically contain strains of lactobacilli that have been shown to colonize the vagina and promote a healthy balance of microorganisms. However, it's essential to consult with a healthcare provider before taking any new supplements. While most yeast infections can be managed with over-the-counter medications, certain situations need professional attention. Recurrent infections, severe symptoms, or unusual discharge should prompt a visit to a healthcare provider. These signs may indicate a more serious condition requiring specific treatment. Section 4. Taking charge of your vaginal health, a lifelong journey. Maintaining optimal vaginal health is an ongoing process that requires attentiveness, proactive care, and open communication with healthcare providers. By understanding the delicate balance of the vaginal microbiome and the factors that can influence it, we can make informed decisions to promote a healthy vaginal environment and minimize the risk of infections. Incorporating the preventive measures outlined in this section, such as practicing good hygiene, choosing breathable clothing, and considering probiotics, can significantly reduce the likelihood of experiencing the discomfort of yeast infections. However, it's essential to remember that every individual's body is unique, and what works for one person may not work for another. Open communication with healthcare providers is paramount in addressing any concerns, symptoms, or potential risk factors. Regular checkups, honest conversations about vaginal health, and timely medical attention when needed are crucial aspects of maintaining optimal vaginal health throughout our lives. By taking charge of our vaginal health, we empower ourselves to make informed decisions that promote overall well-being and a positive relationship with our bodies. Section 1. Understanding yeast infections. A recap. Throughout this exploration of yeast infections, we've delved into the intricate workings of the vaginal microbiome and the delicate balance that maintains its health. We've learned that yeast infections, while common and often bothersome, are rarely a cause for serious concern. They arise from an overgrowth of Candida albicans, a fungus that naturally exists in our bodies, usually kept in check by a complex interplay of factors. We've uncovered the internal culprits, such as hormonal fluctuations, a weakened immune system, and the disruptive effects of antibiotics, all of which can tip the scales in favor of Candida overgrowth. We've also explored the external factors that play a significant role, including our clothing choices, hygiene habits, and even the sweet temptations of our diet. Understanding these intricacies empowers us to move from a place of fear and uncertainty to one of knowledge and proactive care. Section 2. Prevention, your best defense. Armed with this understanding, we can now shift our focus to prevention, for knowledge without action is like a seed unplanted. By making conscious choices and incorporating simple yet effective practices into our daily lives, we can significantly reduce the likelihood of experiencing the discomfort of yeast infections. Choosing breathable clothing, particularly cotton underwear, allows for better air circulation and helps keep the vaginal area dry, discouraging the growth of Candida. Similarly, practicing good hygiene, which includes gentle cleansing with mild unscented soaps, and avoiding harsh douches or feminine hygiene products, helps maintain the delicate balance of vaginal flora. Our diet, too, plays a crucial role. While we may not need to completely forego the occasional sweet treat, being mindful of our sugar intake, especially if prone to yeast infections, can help prevent Candida overgrowth. Section 3. Empowering women through knowledge. Knowledge, as they say, is power, and in the realm of women's health, this rings truer than ever. For far too long, conversations about vaginal health have been shrouded in silence, misinformation, and even shame. By openly discussing these issues, separating myth from medicine, and empowering women with accurate information, we can foster a culture of proactive care and well-being. Remember, experiencing a yeast infection does not diminish your worth or define your health. It is simply a common occurrence that can be effectively managed and often prevented with the right knowledge and tools. This journey towards optimal vaginal health is an ongoing process, one that involves listening to your body, making informed choices, and seeking professional guidance when needed. By embracing this journey with knowledge and confidence, you empower yourself to live a healthier, more fulfilling life.